I am excited to be here today with Dr. Choi, a naturopathic physician here in Seattle. And a little bit of background on Dr. Choi. He entered into naturopathic medicine, was inspired really after witnessing firsthand a gap in the medical system through his grandmother's end of life care. And he was at the time working in Silicon Valley and feeling really dissatisfied. And his mom, a pharmacist, a retail pharmacist, introduced him to the idea of holistic care. And from that inspiration and his own personal experience, he came up to Seattle and earned a degree from Bastyr University. And now, like I said, practices in Seattle and specializes in visceral manipulation and naturopathic medicine. So welcome, Dr. Choi, and thank you for taking the time to speak with me.
Yeah, thanks for having me, Natalie.
Yeah. So I have a few questions that I thought would be helpful for people who are new to naturopathic medicine or curious to learn more. I think it's something that is so beneficial and something I think a lot more people are starting to explore. So yeah,
Let's go for it.
I guess just to start off, how is naturopathic medicine different from conventional medicine?
Yes, as you mentioned briefly in in the introduction, conventional medicine is what I grew up with. My mom's a retail pharmacist. She dispenses medications and consults people on how to use those medications safely.
Mm-hmm.
And for me, it was really a paradigm shift when my mom had told me that if she were to do it all again, she'd become a naturopathic physician. She'd go to Bastyr in Washington and study this other medicine that focuses less on drugs and focuses more on how does your lifestyle and diet and all those other things affect your health. She's like, if you don't need to take medications, don't take medications.
Mm-hmm.
And for me, that was the biggest wake-up call. If the person dispensing these medications is telling me, this is not the best way, although it's necessary, then, what's going on? So in terms of what's the difference between naturopathic medicine and conventional medicine, the way I think about it, I think it's a mindset. It's often a mindset. How do you approach a problem?
Mm-hmm.
So in conventional medicine, often it's how do you diagnose a disease, a dis-ease? How do you find a problem, and how do you treat that problem? Whereas in naturopathic medicine, yes, we do identify diseases and helps us understand what's going on. But
Mm-hmm.
our mindset is health is it's a normal state to be healthy.
Mm-hmm.
And then what is disturbing that normal state of health, whether it's biological, physiological, is it mental, emotional, and how do you start by removing that cause that's disturbing someone's health?
Mm-hmm. Yeah, so it's instead of just putting a Band-Aid over something, really looking at like what's the root cause and looking at it from a multidisciplinary perspective. I think a lot of people just want that one size fits all or just what the magic bullet type of thing. So give me that pill and fix it. But what I'm hearing is being able to actually start to explore from many different angles. And I love that emotional and physical, that combination is really powerful.
Yeah.
So, yeah. And so what types of concerns might a person have that would prompt them to seek out a naturopath?
A lot of the patients I see, they often it's factorial. There's a lot of different presentations, but that might include digestive issues. People might have depression or anxiety, skin issues, like autoimmune diseases, cardiovascular disease, people who have high blood pressure, high cholesterol, blood sugar issues. And the thing is, often someone who has one of those things often has another one of those things.
Yeah.
So when someone comes in to me, they're already figuring out, okay, I've been on my statins for my cholesterol for years, and that's not curing the problem. It's addressing the symptom. Then they're on a blood pressure medication to lower their blood pressure. Then they're on, a diabetes medication to address the blood sugar issue, and then they're on a antidepressant for their depression. So it's really like whack-a-mole, and often people who come to me are realizing, okay, there's got to be something else I can do
Mm-hmm.
for, all these issues.
Yeah, so people who are really tired with the traditional healthcare system, feeling frustrated, or I mean, people who maybe haven't yet gone into the traditional healthcare system and want a different approach. But I'm hearing that people who are dealing with those more chronic things, or where there's a lot of different things going on, and it feels like you're just like you said, that whack-a-mole, just constantly trying to keep up and manage each thing. Yeah, that's really. I think that's helpful. A lot of people don't. Yeah, who aren't sure, are not sure which is better, Western or naturopathic medicine.
Yeah. And it's often a combination because I tell my patients, often my patients will have their specialists. So they go to their gastroenterologist, they go to their, cardiologist and primary care, and I'm just part of their healthcare team because I believe, Western medicine is beneficial and it has its benefits, but it also has its weaknesses. And I don't do everything they do either. So it's more
Yeah.
a team approach. How do we work together to understand what's going on for this person and help them make the best decisions possible?
Yeah, I love that again, that holistic, multidisciplinary healthcare as a team approach. I think that so many, and listening to you talking, there are so many different perspectives that can be brought to the table. And when we limit ourselves to just one viewpoint, we can be missing different pieces of the puzzle. And certain people respond to different treatment modalities. And so having that team approach can be so powerful. Yeah. So thinking about the new year, I think a lot of people are in that mindset as January is quickly approaching. How can you create health changes that will actually stick this coming year?
Yeah, this is something I've thought a lot about through my life. Before I was even in medical school, even it wasn't on my radar to become a doctor.
Mm-hmm.
And I always wondered, there was always things I wanted to try to do in the beginning of the year, whether it's sleeping earlier or maybe just being more consistent, going to the gym, eating healthier. It was always so easy to fall off the train.
Mm-hmm.
So I've thought a lot about psychology and how to make things actually stick.
Mm-hmm.
So maybe we should think of an example from
Mm-hmm.
my own life. I think I'll talk about running because in the last couple of years I've run a lot. I've run a couple marathons. I've reached 1,800 miles this year
Wow.
alone. And so for me, I was the anti-runner. I
Mm-hmm.
was the person who said, I will never run a marathon. I will never run more than like 3 miles.
Yeah.
And part of why I started running was to prove myself wrong. And I was like, hey,
Mm-hmm.
can I do this? Can I actually do this? And I think there were a few things that really helped me decide that I was going to make this work.
Mm-hmm.
For me, running was a challenge. I was looking for something to help like toughen my mindset, to toughen my body, to see if I could deal with challenges.
Mm-hmm.
And initially it was very, very hard. I'm not a morning, I told myself I was not a morning person either.
Mm-hmm.
So there were a lot of obstacles that I had to overcome the last couple of years. So I
Mm-hmm.
think one of the issues with making a change is one, there's stories we tell ourselves.
Mm-hmm.
You give yourself a certain identity. Oh,
Mm-hmm.
I'm a night person. I'm not a morning person. That was mine.
Mm-hmm.
Oh, I'm not a runner. So automatically, if I believe those stories, and if
Mm-hmm.
that's the intention I set in my head, then
Mm-hmm.
everything I do that contradicts that, my brain's like, hey, you're not that type of person. Why are you
Yeah.
doing that?
Yeah.
So I think the very first step is realizing that we have a story, an identity we might be holding on to that might be
Mm-hmm.
subconscious or just
Mm-hmm.
completely unaware of,
Mm-hmm.
and realizing maybe that can change.
Yeah. Yeah. So that fixed mindset, like that idea of a fixed versus open mindset, believing that we do change over our lifetime and allowing space for that.
Exactly. Yeah. So I'd say that's like one of the probably the most important, the mindset behind what you're trying to change and the reason why and how you can actually start doing that. And a couple other things that I think really helped me become a runner was
Mm-hmm.
surrounding myself with runners.
Mm-hmm.
Joining a running group with all, 50, 100 people training for marathons,
Yeah.
waking up at 5 and meeting up at 5:30 to go for runs.
Mm-hmm.
We run when it's hot, we run when it's cold, we run when it's raining,
Yep.
and automatically by putting yourself in an environment where the thing you want to do is normal, it just
Mm-hmm.
becomes part of your day. I barely think about it now.
Yeah, yeah. Not only that accountability, but I know there's that saying, you're the average of the 5 people you spend the most time with. So being around other people with that mindset that you're working on shifting into will help to ingrain that new mindset into yourself. Is what I'm hearing, what it sounds like.
Yeah,
Uh,
yeah. Surround yourself not just with those 5 people, but like
right,
a
with
hundred people who are
exactly.
doing
The
that
more
thing.
the better. The more the better.
Yeah,
Um,
and that
yeah, and I'm
goes
guessing that it
for
just builds upon itself. The more that you do it, then the more you see yourself as this new person.
yeah, and then all of a sudden you're saying, "Oh, I am a runner." And I think where a lot of people in my practice have trouble is making dietary changes, and you
Hmm.
probably know a lot about that. That's what you do.
Yeah.
And the challenge is, it's like, especially around the holidays, it's like,
Hmm.
oh, I know I should be avoiding like eating all that sugar and all, and tons of like if someone's dairy intolerant, that it's hard to avoid those things if you're
Hmm.
going to parties and being around people who are just unaware of why that's important for your health.
Hmm. Yeah.
And so uh, it's a challenge. I think that's something we all have to deal with, but the environment and the mindset behind it, like why you're doing it, and
Hmm.
creating some systems, some structure around that change is the
Hmm.
way to make things stick.
Yeah, and I like what you said about, as I'm listening to you, what comes to mind is this idea of why you're doing it. So when you have a reason for it, where it's not just like some societal, I shouldn't do this, and it's about deprivation, when it's like, this is what I'm doing for myself because this is the type of person who I want to become, that's a lot more motivational and sustainable than feeling like somebody's telling you that you can't do something.
Yeah, I like how you just said, what's the type of person you want to become? And
Hmm.
I think that's more like that taps into something deeper than I want. I want to run a marathon. It's like so. It's like,
Hmm.
that's not enough motivation to actually. Maybe for some people, but if there's
Yeah.
no reason behind it, you don't want to become a runner, or you don't want to become a healthy person. You don't view yourself as a healthy person, so to
Hmm.
speak. It's just putting a huge obstacle in your own way.
Yeah. Yeah. Definitely so interesting. And not I think that whole idea of that mindset shift, starting to even just thinking about things in a different way, and like you said, that initial awareness that's necessary to observe how you are approaching your life, but creating that shift allows change to happen and to be sustainable. So yeah. So what would you say are some of the smallest changes that you can make that will have the biggest impact and the biggest health results? I think people, can get overwhelmed with thinking they need to do a huge life overhauls. So I'm curious, if someone's like, okay, what's that one small thing? Where do I start? What you would recommend?
Yeah, so I like to talk about things I've done from my own experience because I know they work,
Hmm.
and I know how powerful it can be. I'm
Hmm.
not just kind of preaching from a place of theoretical, like, oh yeah, someone said it was good to do. But the
Right.
things that I think are easiest are some of the simple habits. Just one, like I wake up and drink a cup of water. Like
Hmm.
it's automatic. I think I forget that that's not a normal thing for everyone.
Hmm.
I hear, I don't like water, or,
Yeah.
you know, you can learn to like water. Uh,
Yeah.
it, it's one of the best things you can do for your health. A great way to kind of get your, often when through the night, you're dehydrated,
Hmm.
you wake up, and if you don't have enough water, your brain's not going to function well, your digestion is not going to function well, your
Hmm.
blood is going to be thick like molasses.
Hmm.
So it's like have a cup of water. So I drink a cup of water in the morning and a cup of water before I go to sleep. Another simple thing that has really improved my just the quality of my day is how I approach my night.
Interesting.
So being conscious of, am I staring at a screen, at my computer or my cell phone or the TV.
Mm-hmm.
And because that light, it simulates the sun. And
Okay.
our bodies have a natural 24-hour circadian rhythm. Our
Mm-hmm.
hormones change based on times of day, just like all life. We're not immune to that.
Okay.
So it's like an hour before bed, I'll start turning down the lights in my house.
Okay.
I'll use night shift on my cell phone to change the color temperature of the screen so it's more conducive to producing melatonin, the thing that helps you sleep.
Mm-hmm.
So little things like that, I notice that if I deviate from that, I wake up groggier in the morning.
Yeah.
So just
Yeah.
paying attention to that half an hour before you go to bed, and asking yourself, okay, is this signaling to my body it's daytime, or
Yeah.
am I signaling to my own body that it's time to wind down, time
Mm-hmm.
to shift into night mode?
Mm-hmm. Yeah, I think there's a lot of power in like rituals as well, and that, like you said, like the habits and almost little traditions to start and end your day. And also, I'm hearing in that like letting go of that all or nothing mindset around health and around the New Year's, that it doesn't need to be, have 64 ounces of water and, get into bed by 8 o'clock. Little things like just starting with one glass of water and creating a small shift in that evening routine. What about people? I know I often hear like people complaining like, well, I want to watch TV before bed because it's relaxing, or I get home, from work and everything, and it's 7:30 or 8. Um, what are your thoughts? I'm curious, like how you encourage more mindful relaxation or different relaxation that doesn't involve that stimulation. I think we're so connected to screens and all that stuff.
Mm-hmm. That's something I struggle with too. I'm human. I actually got, going through medical school, I noticed I would, at the end of a really long day of classes or in clinic, doing a lot of studying or working on projects, I'd have this intense urge to sit there and just watch mindless TV
Mm-hmm.
and eat a bag of chips.
Yeah.
But over time, I asked myself, am I trying to just escape and turn off, or
Mm-hmm.
am I actually resting? Am I actively rebuilding my resources for the next day? So
Mm-hmm.
the signal that I wanted to just shut down is now I reinterpret that as, okay, I need some self-care here.
Mm-hmm.
And it's not like I'm judging myself. Like once in a while I will watch TV, Friday
Yeah.
night or whatever, that's fine.
Mm-hmm.
But then if I know, okay, I need some more active rejuvenation,
Mm-hmm.
I will do things like take a hot Epsom salt bath.
Mm-hmm.
Instead of watching the TV, maybe I'll take a walk around the block. Like
Yeah.
even just one round around the block, getting some fresh air and moving a little bit helps me kind of find my center again.
Yeah.
I do things like sensory deprivation tanks, float tanks,
Mm-hmm.
once a week, once every couple weeks.
Yeah.
So it's a matter, I think it's really asking yourself a question.
Mm-hmm.
Am I trying to avoid something? Am
Yeah.
I just trying to escape, like sticking
Mm-hmm.
my head in the sand? Or is this a signal to myself, that like a message from my body that, hey, you're pushing yourself a little too hard right now.
Mm-hmm.
You probably need a little bit more rest.
Yeah.
It's how do you interpret those signals that your body's giving you, and how do you address those?
Yeah, so that difference between mindfulness and mindlessness. So numbing, are you numbing out or are you tuning in? And I could imagine with TV, it's like if you have a show on Thursday night that you're super excited about and you are sitting there not distracted watching it, that can be a mindful activity versus just zombie like turning it on, watching some show aimlessly while being on your iPad or phone. The intentionality behind it can make a big difference, is what I'm hearing you say. Yeah, I think that's very interesting. And then also looking, if it is, I'm trying to just escape from my life, then how do you incorporate more self-care throughout the day, or just in general, or getting curious about that, what's contributing to this fact that you're getting to a place where you want to stick your head in the sand, and maybe taking a bigger picture approach to that.
Yeah.
But I think that's helpful. I think a lot of people struggle with how to decompress in a helpful way at night versus just wine and TV.
Yeah, exactly. And I think it's like one question to ask yourself after doing that thing you normally do. Okay, I
Mm-hmm.
need that 2 glasses of wine
Yeah.
to take the edge off. I hear that a
Mm-hmm.
lot.
Yeah.
And it's okay, you have your wine, ask
Mm-hmm.
yourself, does it prevent you from falling asleep easily? Because
Yeah.
often the sleep won't be great. You wake up a
Mm-hmm.
little groggier. It might take an hour or two to actually fall asleep and get deep sleep. And this has been
Mm-hmm.
shown from, I do some heart rate variability testing. So
Mm-hmm.
you can also see that's a measure of how your body's resting and digesting
Mm-hmm.
and calming down. How do you go from the high kind
Mm-hmm.
of fight or flight mode to the rest and digest. So you can see
Yeah.
changes in heart rate variability by having a cup of wine before bed
Mm-hmm.
or watching TV for an hour right before bed.
Yeah. Yeah, definitely. And being able to build that physiological resiliency through more mindfulness. And I think as you're talking, that shift from the glasses of wine to something that's like an Epsom salt bath or a little bit of a different form of self-care is difficult at first. Maybe the bath won't feel as good as the wine, but the benefits that you'll notice in the bigger picture, creating that change, will be much more impactful and noticeable, and worth it. It's understanding that, and starting to pay attention to, well, how does this affect my sleep? How do I feel in the morning versus immediate gratification of that
Yeah,
moment?
yeah.
Yeah. Hard stuff, and also important to explore and to think about.
Starts by asking a question.
Starts by asking a question, exactly. And sometimes we just don't know the right questions to ask ourselves, or nobody asks us that. So
Mm-hmm.
good to think about. So what would you say are the most common obstacles standing in the way of people overcoming illnesses like digestive issues, fatigue, blood sugar issues, or hormonal problems? All of these things so common in our society.
Yeah, the most common, well, there are many factors, right? I can see someone with digestive issues with let's say someone with IBS, irritable bowel syndrome. They call it a syndrome because there's no great way to classify. A
Yeah.
syndrome is basically we don't really know what's going on here. Just so in this case, people are either having like diarrhea, constipation, or a mix of both.
Mm-hmm.
And the causes are different. A lot of people who have IBS are conventionally put on are given antidepressants,
Mm-hmm.
and that's essentially their providers are saying we don't know what's going on. It's probably all in your head. You might
Mm-hmm.
be depressed.
Yeah.
But what that tells me, so as a naturopathic physician, I'm always asking, like, why? Okay. So,
Mm-hmm.
stress might be a reason, your stress levels can affect your digestion.
Mm-hmm.
There is a nervous system in your brain, the enteric nervous system, your second brain, they call it.
Mm-hmm.
So, just your brain and body are connected. So one of the things I think about is like, where is there a stressor in someone's life that might be causing those like butterflies in the stomach, right?
Yeah.
These sayings kind of give you an idea of what's going on physiologically.
Mm-hmm.
So stress is a big one. We're facing more inputs from our environment than ever before,
Mm-hmm.
and most of us, we're kind of the first generation really learning how to deal with it.
Yeah.
So that's a big one. The quality of our food. I think that's a big question mark these days.
Mm-hmm.
Where is our food coming from? How are we eating it? Are
Mm-hmm.
we sitting and being peaceful? Or are we driving in our car, throwing a bar into our mouth while we're like dodging traffic? Your
Yeah.
body can't digest food very easily. So then,
Yeah.
that can be causing, if you do that every day, and then
Yeah.
your again, symptoms are your body's message to yourself that, hey, something is not right.
Mm-hmm.
Um, there's also just we're exposed to a lot more man-made toxins and pollutants. Like at
Mm-hmm.
first, it's kind of overwhelming to think about.
Yeah.
No, it's like I I think one of the things that surprises me to hear is when people say, "Oh, it seems like everything causes cancer."
Mm-hmm.
It's not, and I don't think that's absolutely true, but that feeling like, "Oh, everything I do is killing me."
Yeah.
So for me, I've struggled with that, but over the last 7 8 years, as I've become more aware, I look for my greatest areas of vulnerability and start there. Okay, it's
Mm-hmm.
like, okay, I drink water every day. How can I get
Yeah.
the cleanest water I can? Okay, I'm getting to get a good filter and just start by drinking clean water. So,
Mm-hmm.
okay, you're reducing one risk factor.
Yeah.
Then I evaluate, okay, what am I eating every day? Am I
Mm-hmm.
exposing so the things you do every day matter more than the things you do like once.
Yeah. Yeah.
So the things I'm eating every day, am I exposing myself to maybe too many pesticides or herbicides? Okay, how
Mm-hmm.
can I look at the environmental workings group, their group, there's something called the Dirty Dozen, the list of the Dirty Dozen, the foods with the highest measured amount of pesticides on them. How can I
Mm-hmm.
avoid these things? Like
Mm-hmm.
one of those things with strawberries I was eating a ton of. I'm like, okay, maybe I'll start by buying organic strawberries.
Mm-hmm.
So it's more systematic. Where can I get the biggest wins that might be contributing to an issue in my life?
Mm-hmm. So looking for those low hanging fruit, and again, letting go of that all or nothing thinking, and just saying, okay, what are a few areas? Just like you said, systematically going through and making these small shifts that have a big impact, but yet taking that step back and observing your most common day to day behaviors and things that you're intaking. Um, yeah, yeah,
Yeah.
and so I know that for your work, you do several different modalities, and one of your specialties is visceral manipulation. So I was hoping you could tell me or us watching this a little bit more about what is visceral manipulation and how does it help chronic health issues, and yeah, what does it look like?
Sure, sure. So visceral manipulation sounds kind of scary.
Mm-hmm.
You're going to do what to my viscera? And and when I first heard about it, I was also a little bit confused and skeptical.
Mm-hmm.
Going into school, I always thought I would help people with their diet, nutrition, and their habits, and then that was what naturopathic medicine was, and that's a
Mm-hmm.
part of it.
Mm-hmm.
Then I discovered that there are manual therapies, like using like therapeutic touch
Mm-hmm.
to help people. My first exposure to therapeutic touch was learning how to do craniosacral therapy, which is a gentle manual touch.
Mm-hmm.
And often when we were working, when I'm in the clinic, a lot of people with chronic diseases have a lot of we have to do a lot of counseling around it. It affects their lives on so many levels. Sometimes people
Mm-hmm.
get stuck in that story, right? That negative spiral of doom. You just can't get them out of that
Mm-hmm.
story mode. So I remember one day I had a patient. It's like, okay, why don't we just kind of end today with a little bit of craniosacral therapy? Lie down on the table, place my hands gently. There's certain, I guess, moves that you would do.
Mm-hmm.
The patient calmed down. The patient was more grounded,
Mm-hmm.
and as she was leaving, she
Mm-hmm.
had expressed, "Oh, I forgot to tell you guys. There was this time, it was a really traumatizing time in my life, and this was a big reason why I feel the way I do today." I'm like, "Oh, I couldn't have talked my way into that. There was
Yeah.
something I was doing, this connection, this rapport I was able to build with touch with this patient,
Mm-hmm.
brought something out emotionally and created change."
Yeah. Yeah.
So that, and then as I was exploring different modalities, I came across visceral manipulation, and it's a very targeted therapy to address often digestive issues, chronic pain. Women who have given birth and the tissues of in the abdomen and the pelvis just haven't returned to their normal state after giving birth.
Mm-hmm.
Often they're told either surgery or watch and wait. But visceral
Mm-hmm.
manipulation is a great kind of thing to try before the surgery, and often it's quite effective too.
Right, right. So again, I mean, that prevented doing these types of in naturopathic medicine, these types of treatment modalities as preventative care. If someone's being told, it's surgery, being able to try these different things that do have a really big impact, and produce really great results. And it sounds like visceral manipulation helps people to feel more, what I'm hearing, feel more embodied, and connect with themselves and with you in a deeper way, almost get out of their heads and into their bodies a little bit more. Is that right?
Yeah, that's a big part of it. And I should also say it's very grounded in anatomy. Right? We're working with the fascia, the connective tissue around the organs. So just like you can sprain an ankle, right? There are ligaments and tendons. If you're in a car accident and the seatbelt's right across your chest, and you slam on the brakes or you get rear-ended, what happens to like your organs? Just like your brain, you can get a concussion. Your organs can get concussed. You can have a sprain of the ligaments around the liver. And when your organs lack mobility, then their function is often compromised.
Yeah.
So, it's like, you're working very specifically with the tissues around the organs. So just like there are physical therapists and manual therapists who work with the joints and your muscles, I kind of do that for the tissues on the inside.
Yeah. Yeah, that's so fascinating. So I guess, final question here. If somebody's interested in, say, scheduling an appointment, or I think it would be helpful to know, like, what does that first visit look like? And what does that course of treatment look like? How long do people see you for? And I'd love to hear a little bit more.
So I guess I structure my visits a couple different ways. So if someone's coming to me, if they were referred to me by another doctor specifically for visceral manipulation, treatment kind of starts the first visit. However, before the treatment, we'll do an intake, probably longer than most people have experienced an intake. Half an hour, 45 minutes, really kind of looking at the history of what happened. It's not just a 15-minute visit and then goodbye, but it's more, what's the underlying thing here? What are your goals? What is our purpose working together? Is this a good fit? That's also something I like to be open with. And I do a treatment at the end. And it kind of depends on the issue. Sometimes people are good after 3 visits. Something that's been going on for 10, 20 years. I have a patient who's been dealing with like constipation for like 20 years. That's not going to go away in 2 weeks. So that could be more like a 10, 15 visit type of situation. And visits are often 3 to 4 weeks apart. And the idea is, as someone gets better, I see them less.
Yeah. Yeah.
I'm supposed to be putting myself out of a job, so to speak.
Yeah. Yes. Yeah, definitely. So I think such a great thing to hear is, in our traditional medical system right now, visits are getting shorter and shorter, and people aren't feeling heard or listened to, or, doctors are just looking for what's the main thing, what's the medication that fits with that. And that's not the case for all doctors, but I think in general. And so in listening to you, it's really getting to understand the patient's history on a much deeper level than they might be used to, and developing an actual relationship and seeing the treatment all the way through. So, well, thank you so much for taking time. This, I think, was very helpful and informative, and I appreciate it.
Yeah, this was fun. Thanks, Natalie.
Awesome.